This is a screenshot of a Wolfram alpha search for, quote, heart. Under the section Typical Morphology, a diagram of the heart in frontal position is noted. I have uploaded the screenshot to a program in my iPad called Explain Everything. I am using the application to record my explanation of a section of the diagram. The left anterior descending coronary artery, known clinically as LAD. Note the two ear-like structures. They are the upper chambers of the heart or the atria. The arrow is now pointing to the right atrium. The lower chambers of the heart are the ventricles. These chambers have the largest amount of cardiac muscle per volume. For its lifelong metabolic needs, the ventricles require large arterial blood supply. The left anterior descending coronary artery is now pointed out by the thin arrow. This is the artery that mainly involves the condition known as myocardial infarction or a heart attack. The artery supplies the vast majority of the high-pressure muscular chamber or the left ventricle. A block in this artery will result in lack of oxygen to supply the demands of the constantly contracting muscle. This results in ischemia or lack of oxygenation to the muscle, which could then lead to cardiac muscle death. I will now zoom in and delineate this important coronary artery in black.